Evening. Thank you for being here. But if you miss any part of the show, you can catch the rerun this Friday at 11 a.m. and again on Saturday at 11:30 a.m. You can also read more in my weekly Ask the Doctor column, which is published every Friday, where we take the conversations even deeper. And remember, we're streaming live on Facebook. So wherever you are, you're always part of the conversation. Somewhere in this country, though, a mother is checking her child's fever for the third time. A father is ignoring chest pain because it's probably gas. A young woman is staring at a lab report she does not understand. A diabetic is deciding whether to take the insulin or not, or stretch it another week. Health decisions are not made in textbooks. They're made in kitchens, in traffic, in hospital corridors, in moments of fear. And in those moments, clarity matters. This is where myths are challenged, where evidence defeats exaggeration, and where we confront the realities of our healthcare system, hopefully honestly. And where your questions are not trivial, they are vital. Because illness doesn't wait for convenience. Prevention is power, and knowledge can save a life. This evening, we'll go beyond headlines, beyond rumors, and certainly beyond politics. We go to the science, we go to the truth, and we go to what matters. Let's start with the doctor's capsule. There was a fascinating new study that found persons in their 80s and 90s with exceptional memory, known as super agers, actually produce twice as many new brain cells as cognitively healthy old adults, and far more brain cells than people with Alzheimer's dementia. Researchers found that those persons have increased neurogenesis, which is a big term meaning the birth of new nerve cells or neurons, particularly in the brain's memory center called the hippocampus. And even more remarkable, super agers had more newly developed nerve cells than adults decades younger. Their brains also showed stronger support systems, including highly active cells, which help preserve memory and enhance something called brain plasticity, which is the ability to adapt and repair itself. So the takeaway, the aging brain still has the capacity to regenerate. Experts say while genetics may play a role, lifestyle matters too. Regular physical activity, mental stimulation, good sleep, stress reduction, and control of vascular risk factors like diabetes, hypertension, smoking, or high cholesterol, because these all help to protect brain health. So the message is encouraging to our parents and grandparents. Growing older does not automatically mean decline of brain function, because with the right environment, this magnificent organ can remain remarkably youthful. Further afield, a major new German study of more than 6,000 long-term cancer survivors delivered an encouraging message this week. Healthy living continues to significantly improve life expectancy, even decades after a cancer diagnosis. Researchers followed survivors of breast, prostate, and colorectal cancer for over a decade. Those who did not smoke, those who exercised regularly and maintained a healthy body weight lived noticeably longer than those with less healthy habits. So it's one of the themes of this show, prevention and healthy lifestyles, a diet rich in fruits, vegetables, nuts, peas and beans, low fat and low salt, trying to keep physically active for 30 to 60 minutes most days in the week, stopping smoking if you do, limiting alcohol, and of course ensuring that you get enough rest. Because when they compared cancer survivors with unhealthy lifestyles versus those who were better, mortality was 32% lower amongst those with the healthiest of habits. And interestingly, the strongest risk factor, smoking. People who never smoked had nearly 50% fewer deaths than current smokers. And even quitting smoking reduced the chance of death by almost 30%. Regular physical activity lowered death rates by 22%, and if you maintained a healthy weight, you were 13% less likely to die. Experts say the message is clear. Surviving cancer is not the end of the health journey. You have your surgery, chemotherapy, radiotherapy, sure, and regular monitoring by your doctor. But lifestyle changes remain powerful, not as a replacement for medical treatment, but as an important partner in long-term survivorship care. I just wanted to tackle briefly a growing concern, the modern wellness industry. At first glance, it promotes prevention, gut health, hormones, and optimization. But if you look closer, you'll notice something troubling. It never wants you fully well. It wants you continuously improving. The model thrives on mild dissatisfaction, fatigue, brain fog, poor sleep, and low energy. Symptoms almost everyone experiences in a high-stress, sleep-deprived world. The solution offered is rarely lifestyle change, but it's often a supplement, a powder, the so-called detox trip after carnival, or some new trending compound on TikTok. Unlike prescription medications, most supplements do not require the same level of rigorous proof before marketing, and social media platforms amplify confidence over these sorts of evidence-based treatments that would be prescribed by a doctor. And influencers can recommend all these stacks of hormones, talk about cortisol resets, or even detox protocols without accountability. Some supplements have legitimate evidence. We're not saying that you shouldn't take a vitamin if you're deficient, but endless optimization can become a treadmill. Always another marker to tweak, another product to buy. And the real danger arises when people abandon proven medical treatments for viral alternatives because biology does not negotiate with belief. Disease progresses whether or not it trends online. And the core message is that health is not something you hack. It's something you practice through sleep, movement, nutrition, stress control, and evidence-based care. The body does not follow trends, it follows patterns. Choose wisely. It's time for a short break, and when we return, it's the Medical Mind segment on Ask the Doctor. Get ready for that.
Folks, take a look at all these medical conditions. What does it have in common? This, ITIS. But what does ITIS really mean?
The suffix itis denotes inflammation of a specified organ or tissue.
ITIS really means inflammation. How do we combat chronic inflammation? Through lifestyle changes. Then, and only then, make sure you're getting enough omega-3 fatty acids.
Always consult a qualified medical professional before starting any supplements.
Get a loan at Bremont. The process is simple. Fast and efficient approvals. Receive funds within 24 hours once approved. And no penalty for early repayment. Located at 4 Gala Street, Woodbrook. Remember, we like to lend.
Step into ABC Doors and Windows, where quality meets variety. Discover premium wooden, steel panel, fiberglass, and steel security doors alongside aluminum, UPVC, and steel windows designed for strength and durability. At ABC, we're always a better choice, delivering products built to last and service you can rely on. Visit our showroom at 1 Chanka Trace, El Socorro South, or call 638-7184 to make your dream home a reality.
Get a free pair of polarized sunglasses with the purchase of new Gen S Transitions lenses with anti-reflective coating and frames. Selected designer frames now just $4.99 with additional promotions. Hurry, limited time only at Seaview Optical.
We are your one-stop, most convenient, most helpful, most caring community pharmacy. Our pharmaceutical services include dispensing medicines, repeat dispensing, clinical governance, but we also have a fully stocked convenience store featuring our refreshment aisle, grocery lane, personal care products, toys, pet supplies. We are most conveniently located out of the traffic, just 2 minutes off the highway in Heartland Plaza, Endeavour, Chaguanas. Contact us on 220-8705 or 470-5938 and visit us soon.
At Cruise Inn Hotel and Yachting Center, we're all about time. In fact, once you check in, there's no time to lose. Reconnect with a little family time. Make a splash with some pool time. Spend some treasured quality time. Or just immerse yourself in some quiet time. Indulge your senses at dinner time. We even have the perfect venue when it's your celebration time. So it's high time you visit Cruise Inn. Choose our day pass or call 607-4000 to make your dinner or hotel reservations or to find out more about our event spaces. Take a time out at Cruise Inn Hotel and Yachting Center.
Magical Expressions Limited is the largest local importer and distributor of fresh cut stems, offering the widest range of beautiful flowers at the most affordable prices. Call us today at 701-6488 or visit our website to order.
Welcome back to CNC3's Ask the Doctor, your #1 program for news, views, and interviews of all things medical. Dr. Nadia Watson is a family medicine and palliative care physician with a deep commitment to thoughtful, patient-centered care. Whether she's managing routine infections or guiding families through more complex journeys in palliative care, she brings clarity, compassion, clinical precision, and a dash of humor to every consultation. This evening she speaks about her own battles with a sore throat post-carnival. Let's have a look.
Hi, this is Dr. Nadia Watson with another top tip, and today's top tip is stop trying to be a young girl. And I'm talking about myself because this carnival, I thought I was prepared. I exercise, I eat right, I jump on trampoline. So I was ready to fit. Wednesday, Thursday, Friday, Sunday, and Monday morning was my juve. Well, your girl lasts till Sunday because I end up with a sore throat. So let me tell you what's the most common things that cause a sore throat. The most common thing is a viral illness. And sometimes with that, you can get congestion and you could end up with a sinus drip, and the constant dripping onto the back of the throat could irritate it and cause a sore throat. The second thing is a bacterial infection, but that wasn't my case. I think it was more the Sahara dust. So that's the next one. Dust and allergies can cause a sore throat because it could trigger your sinus to cause a sinus drip and trigger that irritation in the back of the throat. The next one is also acid reflux. If you have constant acid reflux and it coming up to the back of the throat, it can cause it to be sore because acid reflux is actually acid hitting the back of the throat and making it feel very sore. Or you just treat that. Well, I had to doctor myself because Juve morning was coming. And you believe I missed Juve morning because following the sinus drip and following the sore throat, I end up with body pains and I end up on antibiotics. Look upon my Juve ban. I didn't even get to go. This is the first time in a million years I get to go. I'm leaving this on my hand as a reminder to stop behaving like if I was a 15-year-old. Anyway, so I had to gargle salt water. I take vitamin C and zinc. I then take nasal puff. And then I take normal saline puff. I do everything under the sun. And in the end, I even gargle with my salt water. I do the works. And in the end, I end up on the antibiotics. So just in case all is in all your lovely 40s and all you want to do what I do, know your limits. And stop trying to be a young girl. All be safe and take care.
And we say a special thank you to the entire Watson family and that impassioned plea to be careful, particularly with those post-carnival surge in viruses ranging from influenza A to, of course, COVID, because that never ended. Avoiding those closed, crowded, close contact settings. Most persons may improve with fluids, rest, or paracetamol. However, remember that high-risk individuals include those at extremes of age, pregnant women, healthcare workers, and of course, persons with weakened immunities, particularly if you're battling chronic diseases such as diabetes, hypertension, heart or kidney disease. See a doctor if you're uncertain, particularly if there are red flags like chest pain, worsening shortness of breath, blueness to the lips and tongue, unable to tolerate fluids due to persistent vomiting, if you have clinical features of dehydration such as a low blood pressure, fast pulse, or a change in respiratory rate. If you have uncontrolled problems such as your blood sugar or blood pressure, have a chat with your doctor in addition to managing that particular infection. Right, it's time for a short break, and when we return, it's the giveaway segment with the compliments of Great Health Works.
The moment my children came into my life, I do everything I can for them to live healthy, enjoyable lives. Nature's Ways Alive Kids Gummies are multivitamin gummies meant to support the development of children's bodies. They come in delicious fruit flavors and contain natural plant-based pectin. This means that if I'm looking for an alternative to animal-based gelatin for personal reasons, they are the best choice for my little ones. Choose Alive Kids Gummies by Nature's Way for your children because they deserve it.
Gaming Express Limited is a premium importer and retailer of the highest quality brand name electronics. We stock the widest range of PlayStation, Nintendo Switch, Samsung, and Apple devices and accessories. Visit us at Shop 52, Level 2, Gulf City Mall in San Fernando, or contact us by phone or WhatsApp message at 687-7480 or 301-9797 or 798-1280. Like our Facebook and Instagram pages for updates on products and services.
Mom, Dad, this is Trevor.
Hi. He's no Kieran.
Back up.
Fling? That's why he crossed the road. It was funny when Kieran said it.
Oh, who could that be?
We're like the parents who don't miss your ex.
I can't believe Kieran is in the neighborhood.
CG United. Good like that.
Okay, let me see you, Cherry Hill. Yeah, now take it back. Let me see you rock off, shake off, shake off. Let me see you rock off, rock off. Let me see you kick right. Now step forward, now step back.
Lucozade, bring the energy. Unbeatable taste, new look.
Shake off. Let me see you rock off, rock off.
Folks, take a look at all these medical conditions. What does it have in common? This, ITIS. But what does ITIS really mean?
The suffix itis denotes inflammation of a specified organ or tissue.
ITIS really means inflammation. How do we combat chronic inflammation? Through lifestyle changes. Then, and only then, make sure you're getting enough omega-3 fatty acids.
Always consult a qualified medical professional before starting any supplements.
Welcome back to CNC3's Ask the Doctor. We're live on Thursdays with a rerun on Friday at 11 a.m. or Saturday at 11:30 a.m. So it's question time with the compliments of Joseph Sendel and the rest of his brilliant team at Great Health Works. And the question is geared towards healthy lifestyles. And I think it's very relevant based on our opening salvo. What single behavior reduces the risk of heart disease, stroke, cancer, and dementia simultaneously? And it's a best out of 4. Multivitamins, detox programs, regular physical activity, or cold showers. The phone lines are open, the numbers on the screen. Just a reminder, when you're patched into the studio, listen on your telephone rather than the TV set, because there is a delay that creates confusion. So what single behavior? Hello, good evening, welcome to Ask the Doctor.
Good evening to you, sir. Good evening.
Thank you for being part of our program, sir. It's a pleasure to have you on.
Thank you.
And do you have an answer to what single behavior will help all these chronic diseases?
B.
Pardon me?
The letter B, detox program.
Now, it may be useful for certain problems, but it is not the letter B for all of these issues. Heart disease, stroke, cancer, and dementia. Not specifically in terms of hard evidence. We're talking about evidence-based changes and some of those things that may be used by patients or by doctors, some advice, all geared towards battling these chronic diseases, and it's not detox programs for everything. Hello, good evening, and welcome to Ask the Doctor. Unfortunately, in this case, it's not multivitamins. Multivitamins may help with certain problems, especially if you have a deficiency. Let's say vitamin B12. Sometimes if you have a low level of vitamin D, it may help various facets of the human body. But, and of course, vitamin C in maybe the first few days of a cold may shorten the duration. So it's not multivitamins either for all of these chronic diseases. One issue that may help to lower your risk. It's not a silver bullet, of course, but it may help to reduce risk based on the opening salvo. Good evening and welcome to Ask the Doctor. Hello.
Hello.
Thank you for being part of our program. Welcome.
The answer is C.
And the answer is indeed C.
C.
C, regular physical activity. Congratulations, you're a winner. And I wasn't sure if anyone would have called in and said cold showers. There is a school of thought that it might be useful for certain things, but we're talking heart disease, we're talking dementia, cancer risk, regular physical activity for most days in a week. Have a chat with your doctor before embarking on any rigorous program to ensure that it is safe to do so. But well done, you're a winner.
Thank you.
Have you tried these supplements before, ma'am?
Yes, the omega-3.
What has been your experience thus far?
It has lessened the pain.
Okay. So thank you so much for sharing, and stay on the line. We want to take some of your personal information off the air. So, fascinating question, and a reminder to marry some of these other interventions, whether you're taking multivitamins, whether you think that certain programs will help, or regular physical activity with healthy eating geared towards reducing your risk for so many chronic medical conditions. It's time for a short break, and when we return, it's the open forum with some more of your questions and hopefully answers.
Folks, take a look at all these medical conditions. What does it have in common? This, ITIS. But what does ITIS really mean?
The suffix itis denotes inflammation of a specified organ or tissue.
ITIS really means inflammation. How do we combat chronic inflammation? Through lifestyle changes. Then, and only then, make sure you're getting enough omega-3 fatty acids.
Always consult a qualified medical professional before starting any supplements.
Things don't always go as expected. Be ready with Trinry for auto, home, business and group life. Call us at 800-TRIN or visit trinry.com today. Huge insurance premium. Pay your premiums bit by bit with FlexiPay from Trinry. For more manageable auto, home and commercial insurance payments, call us at 800-TRIN or visit trinry.com today. Trinry. Premier insurance coverage for less.
Eye care tips for Seaview Optical. Eat well. Good eye health starts with the food on your plate. Nutrients like omega-3 fatty acids, lutein, Zinc and vitamin C and E might help ward off age-related vision problems. Quit smoking makes you more likely to get cataracts, damage to your optic nerve, and macular degeneration. If you have tried to kick the habit before only to start again, keep at it. Wear sunglasses. The right pair of shades will help protect your eyes from the sun's ultraviolet UV rays. Use safety eyewear. If you use hazardous or airborne materials on the job or at home, wear safety glasses or protective goggles.
Get a free pair of polarized sunglasses with the purchase of new Gen S Transitions lenses with anti-reflective coating and frames. Selected designer frames now just $4.99 with additional promotions. Hurry, limited time only at Seaview Optical.
Folks, take a look at all these medical conditions. What does it have in common? This, ITIS. But what does ITIS really mean?
The suffix itis denotes inflammation of a specified organ or tissue.
ITIS really means inflammation. How do we combat chronic inflammation? Through lifestyle changes. Then, and only then, make sure you're getting enough omega-3 fatty acids.
Always consult a qualified medical professional before starting any supplements.
Welcome back to CNC3's Ask the Doctor. It's time for the open forum with questions of a medical nature. As a reminder, when you're patched into the studio, listen on your telephone rather than the TV set. And we'd love to hear from you. If you wish to listen to my response, that is perfectly in order. As we head to the Southland, as Oro Pooch has been waiting. Good evening, and thank you for doing so.
Good afternoon, doctor.
Welcome, ma'am.
Can you give me some information on vertigo and what is its symptoms?
Yes, ma'am. Thank you very much for opening the batting with a very relevant clinical question, and it's so common. In fact, I believe that the symptom of dizziness is very often a reason for persons seeking medical care. Now, the term vertigo may be a reason for that feeling of giddiness in that there may be a central cause affecting the brain or peripheral cause, usually affecting the inner ear. So the inner ear is involved with balance, and there are usually calcium crystals that float. Sometimes for someone who is very fit and active like you may find that these get shifted out of place. And persons have the sensation of the entire room spinning. It may be associated with nausea, vomiting, and weakness. There are some maneuvers that doctors may perform where the patient lies on the edge of the bed, looks to the left and right to actually determine whether it is due to benign positional paroxysmal vertigo. If you wish to Google for more information, the acronym is BPPV. Benign positional paroxysmal vertigo. The symptoms are benign, but very unpleasant when they do occur, and they may be exacerbated if you change the position of your head. If you're bending to pick up something or looking to the left and right, you may find that sensation of room spinning that lasts a few seconds. The maneuvers, which are also found on things like YouTube or Google to diagnose, can also shift those calcium crystals back into place. So have a chat with your family care doctor or an ears, nose, and throat surgeon. Now, it's not the only reason for vertigo. Benign positional paroxysmal vertigo is just perhaps the commonest cause. Sometimes your doctor may want to consider if you need a scan of the brain, if they believe that the brain is involved. So the back of the brain is called the cerebellum, and persons may find that they stagger to one side when walking, and there may be some clinical features in which they lose their sense of balance and direction when that part is affected for different reasons. So blood investigations, a lying and standing blood pressure. All persons with dizziness do not have vertigo, so that's a saying. You may want to examine the heart, ensure that that is normal. Some patients actually have an ECG to look at electrical activity, and even looking at some of your medications which have been prescribed. Would dizziness be one of the side effects? So blood investigations, a full history, a thorough clinical examination, and then these maneuvers, if it is thought thought that vertigo is due to BPPV. There are some uncommon reasons, including a term called Meniere's, who is named after the doctor who first spoke about it, in which vertigo is one of the features associated with a fullness to the air and sometimes hearing loss and ringing. So some of these symptoms may tend to come with vertigo. They may tend to accompany vertigo and thus prompt a referral to an ENT doctor. Our next caller hails from the east as Arima is on the line. Good evening and welcome to our show.
Hello, good night.
Thank you for joining us, ma'am, and welcome to Ask the Doctor.
Thank you. So I'm calling concerning something concerning about my mother.
Yes,
ma'am. My mother is in her late 50s, and she will get some back pains, and sometimes it goes to her knee. So sometimes when she goes to the pharmacy, they tell her, well, it's her cholesterol high when she checks.
Yes.
Then they will give her medication, but after that medication, it's still there. The pain, where sometimes she can't stand straight, she can't come off her bed, she will have like nausea feelings and etc.
Yes.
Well, the pain, the first they said was arthritis, and they said thyroid, but they could never like give her a proper diagnosis. Mm-hmm. And it's just constant medication, different type of medication.
Yes, ma'am, and thank you so much for calling on behalf of your beloved mum, because that too is a common clinical conundrum. It's difficult to pinpoint a diagnosis, and please, I'm not attempting to make one on the basis of a telephone call, but just to guide you in the right direction so you can discuss such with your doctor. Because some people may have joint pain, stiffness, swelling, features associated with arthritis affecting a specific joint, perhaps to the hip or the knee. But if you're having lower back pain and it's radiating down the leg across the buttocks and the lower limb, it may be due to impingement of a nerve, and that pain is referred to as sciatica. It may be associated with numbness, burning, pins and needles, or tingling sensation. So patients may be sent for perhaps an X-ray or even a scan of the lower back. And simple anti-inflammatories do not necessarily help. It's interesting you mentioned about her history of high cholesterol, because sometimes statin drugs, and rosuvastatin is available freely on CDAP. Some persons would have remembered simvastatin, and patients may find that they get a worsening of muscle aches and pains uncommonly. Of course, I'm not saying to stop your drugs if these have been recommended by your doctor, unless you have a consultation. If she has an underactive thyroid, so that's another entity that you mentioned, people often have muscle aches and pains associated with weight gain, cold intolerance, constipation, a hoarse voice, and mood changes. So these clinical features are not specific, but they may be subtle, and muscle aches and pains may frequently be found. So usually for someone who is battling these symptoms, using the medications for the lipids, the cholesterol, or even treating a thyroid issue may not necessarily help. So you may need to delve a little bit further. Are blood investigations warranted? Does she need to do some inflammatory markers? Does she have joint pain in general? Do we have to consider problems such as rheumatoid arthritis? Has she had an X-ray of the lower back and or the knees? Is an MRI needed if she's having numbness to the waist, changes to her urine or bowel function? Has she had a history of cancer? Is she losing weight? A drop in her blood count? Those may be all red flags to consider an MRI of the lower back. Is physiotherapy or certain changes in medications warranted for someone with lower back pain that might be radiating down the leg? So we're just speculating as to reasons for someone who may be battling her symptoms. Sometimes we send patients for a scan of the tummy if we're thinking the problems may be the kidneys. Occasionally, pain may radiate to the back from organs in the abdomen, including the pancreas. So a plethora of reasons. A good history and physical examination is still needed at the basis of the health center, and then to consider if she needs a referral to the Arima Hospital, the new one, or even to Mount Hope for different tests or further management. As we stay in Arima, good evening and welcome to Ask the Doctor.
Well, good evening, Doctor. Thank you.
You're most welcome. It's a pleasure to have you.
I have two questions.
Yes.
I'm asking for an elderly relative.
Thank you for doing so.
The first question is, what is macular degeneration?
Yes.
And can it be treated and how? And the second question is, the relative fell in the bed about 3 weeks ago. She wasn't injured, but she has noticed that her urine is not as frequent as it used to be. And she wants to know, is that as regular as it used to be? And she wants to know if you can suggest anything, that may be the cause of it. Now, it would flow if she takes a diuretic.
Yes.
Otherwise, she thinks it is not as regular as it should be or as it used to be in the past before the fall. Thank you, doctor, and this is offline.
You're most welcome. Love and blessings to you and the entire family. Thank you for calling on her behalf. And it brings to the forefront two very interesting age-related problems. So the macula is the part in the eye, at the back of the eye, that is involved with your best vision. And there are age-related changes that occur in certain people. And there is a wet type and a dry type. And unfortunately, some of the treatments are not as good as we would like. Those persons are under the purview of an ophthalmologist like Neela, who is an eye surgeon that specializes in diseases affecting the eye. Treatments are far from satisfactory. Doctors may recommend certain specific vitamins based on trials for macular degeneration because it can lead to blindness in various persons, and there are certain injections which may slow the progression. These are unfortunately not readily available within the public sector and can sometimes be very costly. So there are inflammatory changes occurring in the eye and linked to increasing age, age-related macular degeneration. And of course, you want to ensure that there are no underlying medical illnesses that you want to manage, because many people, if they're growing older, may be diabetic or hypertensive, and that can further inflict damage to the retina. So the retina is the film in a camera. It's analogous to a film in a camera located at the back of the eye. So images are actually focused onto the retina, and that macula is the point of best vision. And when that is affected, it can lead to blindness, whether due to diabetes, whether it's due to age-related causes. The other question is fascinating because many people, as they're growing older, may be prone to urinary tract infections. As I mentioned, we're not attempting to diagnose. The persons, particularly if they're dehydrated, if they have reduced mobility, and females in general, if they have a history of diabetes, they have weakened immunities, so they are more prone to getting infections at the bladder or the kidneys. A reduced urine flow, a foul odor, perhaps burning when you're passing water, or even it may cause increased frequency. Those may all herald an occult underlying urinary tract infection. So, and sometimes you may not spike a fever. It may occur in the absence of low abdominal pain. And reduced mobility, falls, confusion, and incontinence are known as the geriatric giants. In elderly people, they may portend any medical problem. So perhaps that fall which occurred could have been a manifestation of an underlying infection. So have a chat with the doctor, maybe some basic blood investigations, and sending a urine sample for a dipstick or in the lab to determine if it grows any bacteria. Are antibiotics needed? I won't say yes or no. Keeping hydrated, monitoring the urine flow. If bloods and urine do not show a reason, you're looking at the kidney function test, and you're also considering an ultrasound scan to pay specific attention at her kidneys, bladder, and perhaps the rest of the abdomen if there are any underlying problems. Our next caller hails from Princestown. Good evening and welcome to our show.
Good evening, Doctor.
Thank you for being part of our program.
I want to ask a question. Could you tell me what is responsible for low platelets and what can be done to increase the platelets if somebody's platelet is low? I would listen to you off air, the person is suffering from a kidney, a problem with the kidney, and it was diagnosed that the platelet is low and you need the platelet has to be increased. Are there any medication to increase the platelet in the individual? I'll listen to you off the air, Doc. Thanks.
You're most welcome, sir. And once more, that booming, distinguished voice from Princestown. Best wishes to the family. Now, for the sake of our viewers, platelets are involved with blood clotting, and they have become a part of the popular lexicon because people remember that when they're battling viral illnesses like dengue, your doctors would often monitor your white cell count, your hemoglobin, and platelets. So platelets are produced by the bone marrow, and there is a plethora of reasons why those levels may decline. So they last a few days in the bloodstream, but when they're produced in the marrow, sometimes there may be medical problems that consume platelets that actually cause these platelets to break down, and your levels decline as a result. And of course, there is the potential for bleeding. Viral infections, we mentioned dengue or leptospirosis. Bacterial infections, fungal problems, these all suppress bone marrow production. Those individuals who consume large volumes of alcohol may find the spleen may become enlarged and sequester or destroy your platelets. There are medical conditions associated with enlargement of the spleen, and this may affect your white red cells and platelets. And I always want to mention the role of drugs, medications. These may sometimes cause your platelet count to fall. So, and there are certain blood disorders that may require the hematologist, who is the specialist that deals with blood and blood-forming tissues, to examine a sample of your blood under the microscope and even consider doing a bone marrow aspiration to determine if there is an underlying blood disorder or a problem that is inherent to the bone marrow. So the cause of the low platelets needs to be elucidated before you can actually treat. Is there an infection? If there is a transient virus such as dengue, fluids, rest, and paracetamol, and the body is self-healing. There is restoration of the platelet count over time. Many of our viewers would have popularly tried things like papa leaves to actually raise the platelet count, but the evidence is limited when it comes to some of these herbal remedies. But it may work because the body is self-healing at that point. Now, if there are medications which are suppressing the platelets, whether it's due to cancer treatment, whether it's certain antibiotics or otherwise, unfortunately, if the bone marrow is suppressed, you may want to consider stopping these drugs and monitoring. So frequent blood tests would be needed for someone like you. I know you mentioned that the individual is battling chronic kidney issues. So in conjunction with your nephrologist, that's the specialist that deals with renal problems or kidney disease, he or she will liaise with the hematologist to determine what is the next appropriate treatment. Now, all people with mildly decreased platelet counts do not require treatment. All that they need will be frequent monitoring. There is an immune-mediated problem, so in which antibodies actually attack platelets. And the acronym for that is ITP. So we're not sure why it happens, but there may be bruises and bleeding, your platelets fall, and if in an acute emergency, sometimes we actually have to transfuse platelets to people if their count is perhaps under 10. So a normal level is 150 to 400. But if your level is low and there's a risk for bleeding, your doctor would want to avoid a catastrophe to consider admission, even to an intensive care unit, for monitoring and transfusion. But we will not routinely infuse platelets for persons who have mild decreases in their counts. Determination of the cause, frequent monitoring, consider referral to that blood specialist called a hematologist, and of course, if you need to do a blood film and a bone marrow test, that would be determined by that particular doctor. And if you have an immune-mediated problem, some people use steroids to raise the count. So what a fascinating set of questions thus far, but it's time for a short break, and when we return, there'll be more of the same on Ask the Doctor. Don't go anywhere.
Folks, take a look at all these medical conditions. What does it have in common? This, ITIS. But what does ITIS really mean?
The suffix itis denotes inflammation of a specified organ or tissue.
ITIS really means inflammation. How do we combat chronic inflammation? Through lifestyle changes. Then, and only then, make sure you're getting enough omega-3 fatty acids.
Always consult a qualified medical professional before starting any supplements.
Ahad One General Store is your trusted destination for tactical gear, accessories, lifestyle items, and more. Step up with tactical boots, protective vests, helmets, explore outdoor gear, utility essentials, and premium attire perfumes, alongside elegant Islamic wear, jewelry, ornaments. Discover toys, RC vehicles, electronic scooters. Visit us in Charleville, Shogunas, or shop online at ahad1.com. Delivery available. Ahad, more than a store, a lifestyle destination.
Ever wonder how the way you start your day can make all the difference? Tired of waking up struggling with congestion? Without Neomed Sinus Rinse, you are likely to battle with nasal congestion, impacting energy levels and overall well-being. The choice is clear. A great morning starts with Neomed Sinus Rinse. Now I can't imagine starting my day without it. All natural sinus relief.
Welcome back to the open forum of CNC3's Ask the Doctor. As we head to reform, good evening.
Good evening, Doctor.
Thank you for being part of the show.
Good evening. Just to clarify a bit.
Yes, sir.
My PSA has been reading a bit high. When I say high, it was 25.
Yes.
I went on some herbal tablets, and it went down to 13. Yes. My last blood test, so it shoot back up to 13. I did an ultrasound, and it shows that the prostate is a bit enlarged. But my concern is the fluctuated PSA. Can you explain that to me, please?
Yes. And you're most welcome. And thank you for bringing this to the front burner, because we know that this specific blood test called the PSA is used as a screening tool. It's imperfect, but it is used as a screening tool for men with prostate cancer. And it's been thought that we should start screening from the time we reach 45. Now, in all men, the prostate may become mildly enlarged. Does not mean that it is cancerous, and this may also cause a rise in PSA. That's why it's not the best screening test to exclude cancer. However, it's worrying if it's very elevated. Sometimes if the prostate is inflamed, the term is prostatitis. So some men may have changes to the urine, may have burning, and the prostate gland is about the size of a walnut. It's near the bladder, and it's involved in the production of the fluid that makes up semen. So a prostatitis, benign enlargement of the prostate, is one of the possibilities, and then we want to be careful about prostate cancer, particularly in the Afro-Trinidadian male, and if you're over 50 with a family history, you want to be vigilant. In the presence of symptoms, weight loss, back pain, these may all be red flags that point towards prostate cancer. I would advise that if you're at present under the care of a primary care doctor, consider visiting a urologist. That is the name of the specialist that deals with problems affecting the prostate, stones in the kidneys, and sometimes if you need surgical intervention to that part of the body. And many, apart from an ultrasound scan, will consider whether there is a need to do a prostate biopsy, to actually take a sample of certain parts of the prostate to examine under the microscope to exclude cancer. Having said that, in many men, prostate cancer is slow growing. We sometimes wonder whether or not other medical problems will tend to account for mortality rather than prostate cancer. But the fact that it's been elevated, the fact that it's been fluctuating over the course for the last few months perhaps, or the last few years, means that a urologist should be involved to consider prostate biopsy, and some even send for an MRI scan of the prostate to determine whether there are any suspicious features, in conjunction, of course, with a rectal exam. So multiple reasons for a high PSA, and prostate cancer is not the only cause, but it must be excluded in conjunction with your specialist, with you at the center to discuss the next best step. And healthy lifestyles remain important when we're talking about prevention of prostate cancer. So, parting is always such sweet sorrow, but in closing, I want to pay tribute to the fantastic Coco Payol Museum in Flanagan Town. So that's nestled in the Central Range. In a world that moves fast, that space feels like a gentle heartbeat of our heritage. It reminds us that health is not just about blood tests and prescriptions, but about roots, culture, memory, and connection. Walking through its doors is like stepping into a living story of cocoa, craftsmanship, and quiet resilience. Kudos to all involved, the Ragbir and Timol families. It was there that I had the pleasure of meeting my close friend here, Ronnie Budu Singh, a man whose warmth matches the richness of the cocoa history preserved within those walls. Happy birthday, Ronnie. May your year be as rich as our cocoa heritage, as warm as good company, and as enduring as the stories kept alive at Coco Payol, a place to visit. Places like that museum heal in ways medicine cannot, by nourishing identity, community, and pride. And sometimes that is the best therapy of all. Our closing quote is from Frederick Douglass. It is easier to build strong children than to repair broken men. He captures a timeless truth about prevention. Childhood is foundation. Childhood is about establishing habits, confidence, resilience, and values. These are shaped early, and they tend to last. When those foundations are weak, repair in adulthood, while it's possible, it's far harder. And you know, we see the same thing in medicine. We see this daily. It's easier to prevent disease than to treat its complications. Easier to nurture mental strength than to rebuild it after years of damage. Thank you for trusting me to walk beside you each week, in your homes and in your hearts. To my team behind the lens, to the dynamic duo of Neela and baby Daniel, and to you, our viewers. Stay strong, stay curious, and never stop choosing kindness. Rest, reflect, love deeply. God bless, and we'll see you next week on Ask the Doctor.
You're watching CNC3.
It's time for Celebrity Family Feud. We're cooking up a good one tonight. It's Emmy-winning celebrity chef Paula Deen and her family, playing for the Paula Deen Bag Lady Foundation. They're taking on Emmy-winning celebrity stylist Carson Kressley and his family, playing for the Aldi Rodriguez Liver Foundation.